Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on pathology. What exactly happens in your lungs and in your bronchi when you have asthmatic attack. So when there is an allergen that enters into your respiratory tract, especially the large one, that is trachea and bronchi, there will be a hyper reaction to that. With this reaction, there are two things that are going to happen. One is your trachea and bronchi, which is wide open, will suddenly contract. That is known as bronchospasm. Because of that bronchospasm, what happens is that airway get narrowed, and also it irritates the mucous membrane. Once the mucous membrane is irritated, it produces lot of secretions. This is known as mucus that comes as a cough or sputum. So because of the accumulation of the sputum and also narrowing of the bronchi, these are the two things. One is bronchospasm and accumulation of mucus in the bronchi and trachea, that causes narrowing of airway. Because of narrowing of airway, you gasp for breath. The air you take inside is not sufficiently providing oxygen to you. That's the reason you tend to breathe more and you have the asthmatic attacks. And this bronchial wall, once it is exposed to the allergens, it is full of inflammatory mediators. It has lot of histamine in it and also a lot of other chemicals that can trigger further reactions. And also your immune cells, neutrophils, basophils, eosinophils, monocytes, all these are accumulated in your trachea and in your mucus and also in the mucous membrane of your respiratory system. Because all of this, you will have asthmatic attack or asthmatic symptoms. To understand it in a very simple way, you have to remember two things. There will be a bronchospasm where your smooth muscle, there is a muscle surrounding your trachea and bronchi. This gets spasm and this get constricted so that the airway is reduced. In this reduced airway, again there will be secretions. Because of the secretions, there will be further narrowing of the trachea and bronchi. This causes you to gasp for the air. This is the simplest way for you to understand about the reasons or the pathology of asthma. And coming to asthma, normally it is categorized into two categories. One is atopic asthma and one is non-atopic asthma. Atopic asthma is a genetic basis. You have already a predisposed genetic condition. In non-atopic asthma, there is no genetic predisposition. So atopic asthma is always because of allergies. So it can be skin allergy, it can be respiratory allergy, it can be food allergy, any of the allergy. But in non-atopic asthma, there is no allergic background. It can be directly happen. Coming to atopic asthma is mostly seen in children. The adults who are suffering from atopic asthma have a history of asthma from the childhood. But in non-atopic asthma, the asthma comes in the later age or the adult age. There is no history in the childhood. IgE is a type of antibody which is produced in blood. In atopic asthma, lot of IgE is seen in your blood. In non-atopic asthma, there is no raised levels of IgE.
Fidicus Homeopathy.